Nasal septal hematoma. Management in the ER. What is a nasal septal hematoma? It's a collection of blood between the perichondrium and the cartilage of the anterior nasal septum. This is usually an avascular area. The septum gets its blood supply from this perichondrium, so a septal hematoma can devascularize the septal cartilage. Septal hematoma usually follows nasal trauma, a fracture, a contusion, or nasal surgery. They rarely occur spontaneously. A good rule to follow is to always check for a septal hematoma in any nasal injury. Symptoms may include nasal obstruction, nasal pain, and rhinorrhea. If the hematoma has been present for a few days and has become infected, the patient may have a fever. It looks like a smooth pink swelling based centrally in the nose. A turbinate is based laterally. It's important to treat a septal hematoma urgently. Within 72 hours, septal cartilage necrosis will occur, which is irreversible. This will result in septal perforation and possibly even a saddle nose deformity if extensive. You'll want to examine the nose with a nasal speculum and a bright light, preferably a headlight. Palpate the swelling with a cotton-tipped applicator. It'll be soft, you won't feel the firmness of the underlying cartilage. Spraying a topical decongestant will not shrink the swelling. To manage a nasal septal hematoma, gather your equipment. Get a good headlight or someone to hold a flashlight for you. You should have a nasal speculum. Cotton balls, cotton pledgets and cotton-tipped applicators are helpful. A Fraser tip suction, the tubular one, is good. A 10 ml syringe with a fairly large needle, a 15 or 11 blade, and some nasal packing material will be needed. For medications, get a topical decongestant like oxymetazoline, 4% lidocaine, which is the topical type, and possibly 1% lidocaine, the injectable type. Antibacterial ointment is needed if you plan to pack with a nasal sponge like Maricel. To anesthetize the nose, you can soak cotton balls or pledgets in a half-and-half mix of 4% lidocaine and oxymetazoline. Place this into both sides of the nose for about 10 minutes. Once you've removed the cotton, replace the nasal speculum and use the syringe to aspirate the hematoma. Enter inferiorly and anteriorly, looking for the area of maximal fluctuance. Drain all that you can. This is sufficient for a small hematoma. If the blood is not completely evacuated, use a 15 or 11 blade to make a vertical incision near the front of the hematoma and suction out blood with a Fraser tip suction. If the opposite side is not decompressed, incise that side as well. You need to stagger the incisions to prevent a septal perforation. Vertical incisions give you more room to stagger them. If you see pus, send a culture. Once it's drained, place bilateral nasal packs to prevent reaccumulation. Packs usually stay in 2 to 5 days. You should prescribe prophylactic amoxicillin to prevent sinusitis while the packs are in place. The easiest type of pack to place is a nasal sponge or tampon. Maricel is one brand name. Coat it in antibacterial ointment to lubricate it. Grasp it along its length with a bayonet forceps, and slide it along the floor of the nose. Once in place, wet with saline dripped from a syringe to expand it. This shows placing a nasal sponge manually. Aim low. Remember those COVID swabs. Urgent management is important for a good outcome. At discharge, prescribe antibiotics and analgesics. Follow up with ENT within 2 days. Recap of key points. Always check for a septal hematoma in nasal trauma of any type. Septal hematomas need urgent drainage. Within 2 days but preferably right away. After draining, place bilateral nasal packs to prevent reaccumulation. Here's a good YouTube video on draining septal hematomas.